Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron. I'm here to bring you cutting-edge insights and practical strategies from healthcare experts for your journey to Prime Health in life and in business. But I want you to think about this for a moment. Have you ever been told you need a knee replacement or suck it up until the pain gets so bad you just can't handle it anymore? Well, what if there's a third option? Well, our guest today, orthopedic surgeon Dr. Marc Pietropaoli, has spent nearly 30 years focused on a different path: repair, not replace. And if you know anybody that's had a knee replacement, they might have wanted to go his avenue versus the others. But before we jump into the episode with Dr. Marc, I just have a quick message from our sponsor, Grow Solutions. We partner to transform passionate healthcare practitioners into profitable practice owners without overwhelm or guesswork. Now, Grow Solutions is not an agency or vendor. We are your growth partner, and we take a diagnostic approach to your business. We analyze where time, money, leads, or opportunities may be leaking. So we eliminate stressors in the business, such as new patient or client acquisitions, marketing or growth strategies, reducing operational chaos with proven systems, frameworks, and SOPs. And we absolutely help you with those AI robots that are out there, because they're coming for us whether we like it or not. So if you've ever thought this: I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we can be your solution. Just drop the word GROW below and we'll get you signed up for a free consultation with me. But you came here for a purpose, and that's to hear from our guest today. So Dr. Marc Pietropaoli, welcome to the Prime Health Podcast, and please tell us a little bit about yourself and what you do.
Well, first of all, thank you, Dr. Barron. I appreciate being on your show. Thanks for the invite. And thank you to all your podcast listeners and watchers out there. I hope we have a great show here. I know we will. And yes, I'm Dr. Marc Pietropaoli. I'm a fellowship trained sports medicine, orthopedic surgeon, and regenerative medicine specialist. I'm based in Skaneateles, New York, which is up near Syracuse, New York, in the upstate New York area, in the Finger Lakes region. Beautiful area. We're actually getting a little sun right now, which is rare. So I have been, as you said, in practice about 27 years now. And I think a really cool story to start with is how I got involved in what you just talked about: repair and not replace. Because I'm an orthopedic surgeon, and I was taught that if someone has knee arthritis or hip arthritis or whatever, that, replacement is the only way to go. So back in 1991, when I was a third year medical student, I was at Syracuse Upstate Medical University, and I knew I wanted to be an orthopedic surgeon because my uncle, who was the original Dr. Pietropaoli, when I asked him, I said, I want to be a sports medicine doctor. He said, well, you got to be an orthopedic surgeon to be a sports medicine doctor. So I said, great, I'll be an orthopedic surgeon. So your third year of medical school, you go through all the different rotations: internal medicine, pediatrics, cardiology, et cetera. So it was the end of the year, and orthopedics was my last rotation, which was great because now I had seen everything. I liked everything, but was this really what was for me? So I found out the day before that my rotation started that I was going to be watching Dr. David Murray, who was one of the original inventors of knee replacement, take a chief resident who's in their last year of training through a knee replacement surgery. So I was all excited. And I got there early the next morning, and the junior resident who's in his third year, he's like, Mark, you're a third year medical student. You're not going to scrub in, but just kind of stand over in the corner there and don't touch anything. But, feel free to ask any questions, because there's no such thing as a dumb question. So the patient got wheeled into the room. Dr. Murray comes in. The nurses transfer the patient over to the operating room table. The anesthesiologist puts the patient to sleep. And then Dr. Murray and the resident drape the patient, and he says knife, and they start the surgery. So they make a big, huge incision. And next thing I know, there's bone exposed. They're using power saws. They're using hammers. They're using drills. And there's cartilage and bone flying all over the place. And at first, I'm very excited because I'm like, oh, I love using power tools. My dad taught me how to use power tools. And then I was like, well, this is actually kind of gross. And then I even said, this is kind of barbaric. There's got to be a better way. Is there any way to grow back cartilage or cure arthritis? So I remembered what the resident said, and I sheepishly raised my hand up. And he looked at me like, this guy's going to actually ask a question. And then the chief resident glared at me. The nurses definitely glared at me. The anesthesiologist's eyes open wide. And then silence, nothing. So I started to put my hand down, and Dr. Murray noticed me. He looked over his glasses. He said, Mark, you have a question? I said, yes. Dr. Murray, first of all, thank you for letting me be here. This is amazing. Love watching this. But my question is there any way to cure arthritis? Is there any way to grow back new cartilage? Is there any way to repair a knee and not replace it? And before Dr. Murray could even answer, the chief resident pointed at me and said, no, there's no way to cure arthritis. There's no way to grow back cartilage. There's no way to repair a knee and not replace it. So at that moment, I realized there was such thing as a dumb question. Other than feeling about 2 inches tall and embarrassed, the light bulb went off in my head. I didn't know how I was going to do it. I was a third-year medical student, but I said, I'm going to prove that chief resident wrong, and someday I'm going to figure out how to repair knees and not replace them. And now, 37 years later, I've written a book, Repair, Not Replace, and that's what I'm preaching.
Yeah. Well, I'm glad that you had to go through that situation. I'm sure your patients have loved the process along the way. As a surgeon, you still do operations as well, but the patients that you can help avoid that, blood, bone, cartilage, everything flying around are probably pretty grateful to that point. So what do you believe is really the source of knee pain it's often misunderstood, and what does the role of bone play in that?
Sure. I think a lot of people don't even know what arthritis is. And so arthritis is, if you ever look at, let's say you rip a drumstick off a turkey or a chicken, you see that white stuff on the knuckle, that's the articular cartilage. That's kind of like the tread on a tire. So when that wears down, that's what arthritis is. I know you know this, but underneath that's bone. And so you hear about bone on bone. When the cartilage wears down, it's bone on bone. It's not always bone on bone, but as that cartilage wears down, more and more force gets transmitted to the bone underneath, and the bone can start to break down faster than the body can heal itself. And you can get these soft spots. We call them stress or microfractures. Another thing is that bone has millions of pressure sensitive nerve fibers. So when you get these stress or microfractures, the bone is very painful. You get a lot of pain. The pain from arthritis comes from the bone. It doesn't come from the cartilage. The cartilage doesn't have any nerve fibers in it. So the bone is actually the source of most of the pain, not all the pain in arthritis. And that's the bad news.
Yeah.
But the good news is we can actually repair that. And that's where we get into repair, not replace. And I mean, if we want to geek out, we can talk about Dr. Hernigou's study at some point here as well. But there's research. People say, oh, there's no research on regenerative medicine, or there's no proof, it's experimental. It's not. There's lots of research and studies on this.
Yeah. We'll dig into that for sure. You've done surgeries, probably thousands of them. Within your opinion, what's the biggest mistake that patients make before they really go? Like, should they be asking more questions other than just agreeing and being told you need a knee replacement? Should they be asking their surgeon questions about what are my options?
Well, they should. And a lot of surgeons, it's not necessarily their fault either. The way we're trained is we're trained that if someone has, like I was trained there, indoctrinated day one, and then throughout my residency, is that there really aren't any other good options once you get past cortisone, which we know damages cartilage, and maybe gel injections or physical therapy. Then it's like either get your joint replaced or suck it up. And a lot of doctors don't even realize there's a third option. And a lot of patients definitely don't realize that. So asking the questions is great, but I also think getting online, now that's a double-edged sword, as you know, right? Yeah. But getting online and educating yourself. And then, I mean, my book, not to throw a promo in right up for the bat, but it is written for patients. It is based on research. There are references in there, but it's mostly patient stories. And that's like that story I just told. I instruct people in my book based on telling stories. So it's a lot easier to read. It's not like I'm just talking all about scientific studies, et cetera. So it's a lot more relatable. Mm-hmm. And I think that's the type of, there's a lot of doctors, not a lot. There's a fair amount of doctors now that are starting to realize this and getting more into regenerative medicine and functional medicine. And I think chiropractors have always been a little bit ahead of the curve on some of that stuff, functional medicine doctors. But there's a lot more, even orthopedic surgeons getting in on that. It's just, there's so many more who don't know yet. And so the word is slowly getting out and the studies are slowly getting out. But yeah, ask as many questions as you can. And if you don't get the answers you want, then go to a second opinion. If you don't get the answers you want, go to a third opinion. If not, you're still not getting answers, watch your podcast, because then you're going to get all the answers you need.
We'll get some more answers for him for sure. I guess I would like to ask the question, when you, like, the differentiator that you are as the physician and for what you've gone through, especially for repair, not replace. Let's just say I'm 72. I've got left knee pain. I went to one surgeon. I was told I need to have knee surgery. They come in, I come in to see you. And you're like, let's do a full evaluation. We'll go over this. And I want to talk to you about repair, not replace. What would that visit look like? And how could you instruct me that surgery isn't the only option?
Right. I think that's another thing. What do you think the average, and I ask your viewers out there, and mentally in their head, what is the average amount of face-to-face time that your healthcare provider spends with you?
6, 7 minutes, 10.
Right. I mean, the most common response I get when I go out and talk to people is 10 minutes, 15 minutes, 8 minutes. I mean, it's actually about 7 minutes. So let's just say 10 minutes. Even that, is not enough to really get to know somebody, to get a comprehensive history, to do a comprehensive physical exam. A lot of patients come to me and say their doctor never even examined them, never touched them. They just threw the x-rays up and said, you need a knee replacement. I mean, that's not medical care. Now, again, the insurance companies, the hospitals, the corporate medicine forces doctors to see as many patients as they possibly can. And that's kind of the unfortunate thing. And so a lot of doctors can't even practice what we were taught in medical school. But I've gotten out of the system. And so you're right. Taking time is the number one secret sauce, taking time with people. And then the other thing is finding that root cause. What really is causing the pain? I can't tell you how many patients have come to me, and you're a chiropractor, you know this. They say they have knee pain. They've been told they need a knee replacement. They've been told they have bone-on-bone arthritis. And we get the x-rays. They're not really bone on bone. We have our therapists work with their back, and next thing you know, their knees are feeling better. So we take a holistic approach. We're going to look at the patient from head to toe. So a visit with us would be literally maybe 4 or 5 hours. And people, I don't want to spend 4 or 5 hours, but it may take you 4 or 5 months to get through that cycle of insanity, going through all the insurance hoops you have to jump through, going to physical therapy first, getting a cortisone shot, all these things. And then they still tell you need a knee replacement. So we're going to get all your old records even before we see you. We're going to call you the day before and have all the past history in there. So when I see you, or my PA sees you, or one of my team members sees you, they are going to already have your history. We're going to go through your current history. So we're going to spend about an hour with you right off the bat to do an extensive physical exam, which a lot of people don't do. And then we're also going to do a set of x-rays where we know they're weight-bearing x-rays. We're looking at the kneecaps. A lot of times they don't get kneecap x-rays, patella x-rays, and there can be a lot of arthritis under there that's missed. We have a lot of people who are told they have bone on bone when they don't. We'll do an ultrasound. Now, I love ultrasound because it's like having a set of x-ray vision, but it's not x-rays. It's actually sound waves. And we can look inside a knee. We can look inside a shoulder. It's so great for looking at the rotator cuff, a hip. So I don't just take care of knees. I take care of the whole body. And we can look inside dynamically and see how those tissues are actually functioning and working. So an ultrasound, we'll also do an MRI looking for those bone marrow lesions, those stress or microfractures. Okay. And then after that, we're going to have you seen by our what we call it V-Motion Fit, our V-Fit team, because these are all healthcare providers. They might be a doctor of physical therapy, PTA, ATC, and then they're all fitness experts as well, certified strength and conditioning specialists. So they will look at you from head to toe. And the neck can sometimes cause pain in the foot, right? The back can cause pain in the knees. The hip can cause an issue with the knee. So we're going to look at the whole body. And yes, you might have a knee issue, but we're going to help you get better from that. But if we don't take care of the hip tightness and the Achilles tightness and the back problem, that pain may just come back. So we're going to look at your whole body. Then the team's going to meet and go over what we think the best plan would be. And then we're going to meet with you and your spouse or your partner or your loved one or a relative, whoever. We always want there to be 2 people. And we're going to really dig deep into what your goals are, because everybody's goals are different. If you want to sleep through the night without pain and walk around the house without pain and maybe walk your dog, that's a lot different goal than someone who wants to play pickleball. That's a lot different goal than someone who wants to play with their grandkids. different goal than someone who wants to travel the world or hike mountains, and different from someone who wants to run marathons. So we use the regenerative medicine principles, but we use them differently in each category. So first of all, we figure out if you're a candidate, because not everybody is. Some people are so bad or have an issue that needs surgery. I'm still a surgeon. I still do surgery at times. And if there's a piece of cartilage floating around in your knee, no shot is going to get rid of that. I got to get that out of there first. But I'd say 85 to 95% of the people don't need any surgery, and we can take care of them without needing any type of surgery. It's probably even higher than that. But if you do need a surgery, we'll help you find the right place. And if we can't figure out what's wrong, then we would certainly give you your investment back.
Yeah. Wow.
So we take a full day, 4 or 5 hours. We'll even send you to lunch. And by the end of that day, we guarantee you're going to know what's wrong with you. Now, if you don't know we can help you with repair, not replace is one thing. Most of the time we can, but at the least you're going to find out what's wrong. And then we're going to give you some options, and it's your choice to decide what you want to do.
So you're saying 85 to 95% of the people that walk through your door, you can give them the repair, not replace possibility.
I would say it's probably even higher than that, but let's just be conservative and say 85 to 95. Yes.
That's incredible. As we spoke earlier, I worked for an orthopedic surgeon. There weren't too many people way back in that day that walked in his door that said, "Hey, I hurt here on my knee." And he said, "Okay, let's set you up for surgery tomorrow." Like
Absolutely.
There were,
and that's how it was taught.
Yeah. And I don't want to say he had great results, but why not? Like, if you have a patient that comes in, I'm 72, I go through your program, I get, PRP or stem cells, and I'll have you talk about that in just a moment. But if I get those procedures done, what if that keeps me until I'm 77 or 82? And then if I have to have surgery, you can help me with that. Why not go there before? Why not do conservative care prior to that? So that's great to hear. So the people up in where you're located are very fortunate. I assume you probably see people from around the country as well.
Yeah, we see people from all over our area, New York State, the Northeast, the United States, a lot of people from Canada, Toronto, and then we even get people internationally. We've had people from Europe come over, and that's why telemedicine, COVID had a lot of bad things, but a few good things came out of it, and one of them was telemedicine. And even like what we're doing right now, right? We can help treat patients. We can't do the injection or telemedicine or surgery or whatever, but so you do have to visit us for that. But I had a woman come over from Belgium. We took care of her knee, and I never saw her in person again, but we would have plenty of visits like this. And my therapist, my V-Motion Fit experts would do sessions with them. So all the rehab and all that stuff can be done over telemedicine if need be. Yeah. And it's always great to have people who come in and you can do hands-on, but it's amazing how good we got when COVID hit, where we had no choice.
Yeah.
How we can help people out. And so we're really good at telemedicine, and it works out very well.
Yeah. And that's all under one roof as well. Like, I know orthopedic surgeons that here's my clinic. If you need rehab, go here. If you need something else, go there. If you need ultrasound done on your shoulder, your knee, wherever it may be, go over to that place and then come back. So it's all in one place.
Yeah. We call that the cycle of insanity, right? How long does that actually take you? So that's why people might say, I don't have 4 or 5 hours. Well, do you have, 3 to 6 months or 4 or 5 months to go through that cycle and still at the end of it not know what's wrong? So a lot of people, their time is so valuable to them, and they just to know in one day what's wrong and finally understand and have it explained to them. I'm going to show you your MRI. I'm going to go over it with you and actually show it to you. I'm going to show you the ultrasound as we're doing it. I'm going to show you your x-rays. My team is going to do all that too. I mean, my whole team is amazing. So it's really, we set a time aside for the whole team to take care of that person holistically in one day.
Yeah. Well, I do want to point out here in your book again, that if I get this in the center, on page 93, you have specifically the cycle of insanity.
Oh, yeah. Yeah, it's great.
Talks about it. And then on the next page, you have Clarity Day. Tell me a little bit more about what Clarity Day is.
Well, Clarity Day is pretty much what I just talked about. So you come in that day, we'll have all pretty much exactly what I just talked about. So we don't go through it again, but yeah, that's a Clarity Day basically to go through and figure out what's wrong all in one day.
Yeah. Excellent. So my next question is that we kind of hit on a little bit about it, but with your repair, not replace, if they're not a candidate for surgical intervention, what options do they have specifically? We mentioned some PRP stem cells and, peptides are options. Would you mind sharing a little bit of your knowledge on those?
Absolutely. Do you mind if I geek out with one study?
Please do. Yes.
Okay. So this is because we talked about how, you said you worked for an orthopedic surgeon and all they did was surgery. And that is kind of what you're taught as a surgeon. But this is an amazing study by a French orthopedic surgeon, Dr. Philippe Hernigou. And when people say there's no research or this is new, this isn't new. This is back in the late 1990s, early 2000s. He had the idea that we have stem cells in our body, which that wasn't his idea, but we know that there's stem cells in our bone marrow, especially, but all throughout our body. And so his idea was, or his thought was, as we get older, we have less stem cells in our arms and our legs and our extremities. And so those are repair cells, those stem cells. They can turn into cartilage, tendon, bone, ligament, heart, lung, liver, whatever, in the right circumstances. But they also act more like boss cells as well. They can tell other cells what to do so they can repair. And if you don't have as many stem cells, which some of them are repair cells, some of them are boss cells, then you can't repair yourself as well. That's one of the many reasons why as we age, we break down. But in our pelvis, not the hip, the ball and socket joint, but the pelvis, which is that bone between our upper and lower body, right in the backside, right above the buttock, there is an area called the posterior superior iliac spine, PSIS, not to get too technical, but it's right under the skin. You can numb the area up in the office and we can harvest bone marrow cells from there because even into your 80s, you have good bone marrow stem cells from there. So his idea was if we take some stem cells from the pelvis, concentrate them, and then inject them into the knee in those soft spots where there's not as many stem cells, will that work as good as a knee replacement? So he had 140 patients. All of them had severe arthritis in both knees, and they were told they needed knee replacements on both sides. So he said, I'm going to do he's an orthopedic surgeon. He said, I'm going to do a knee replacement on one side. I'm going to harvest stem cells and just little poke holes. I'm going to do stem cells into those bone marrow lesions on the other side. And I'm going to follow these people at least 10 years. As you know, a lot of studies are only 2-year follow-up if they're even lucky. So this was 10-year follow-up minimum. And by the time the study was over, some people had been followed for 15 or 20 years. So the average follow-up in this study was 15 years. And at the end of the study, 82% of the knees that just got the little injections, the bone marrow injections, 82% of those knees never needed a knee replacement over 10, 15, or 20 years. Whereas the knees that got the knee replacement, 15% of those went on to need another knee replacement in that 10, 15, or 20 years, which is a revision. And revision surgeries are, as you know, from your son's experience, revision surgeries are not as successful. There's more risk of complications and they don't last as long. Mm-hmm. So if doing bone marrow, taking stem cells and injecting it into the area can reduce your risk of needing a knee replacement by 82%, would you take that?
Absolutely.
Right. So for 10, 15, or 20 years, by the way, that's pretty amazing. So number one, we absolutely offer bone marrow cells, which has stem cells and other cells that help the stem cells. You mentioned PRP. PRP stands for platelet-rich plasma. So our blood has lots of growth factors in it. That's why we don't fall apart. As we get older, none of that stuff doesn't work as well as it used to, but still, if it didn't work, you'd fall apart. Mm-hmm. So our platelets are those things that when you cut yourself, you form a scab and you stop bleeding. And those platelets also have growth factors. So they release those growth factors, and those growth factors stimulate new blood vessels and cells to come in the area. So if we can take some blood, spin it down, and isolate the platelets, because when we spin them in a centrifuge, which is like a washing machine, the red blood cells and the white blood cells settle to the bottom, and the platelets are suspended in the plasma, which looks like yellow stuff. Then we spin it again, and the platelets settle to the bottom, and we get a very concentrated dose of platelets, which is basically like Miracle-Gro fertilizer. So we can inject that into different areas, and it can help the body heal. The younger you are, the better that is. So if you're in your teens or 20s, PRP can work magically. As you get older, it still works, but it doesn't work as well. It may take more than one injection for tendon problems and things like that. And the biggest thing with PRP, and probably even bone marrow, is dose. So a lot of people might say, well, I had PRP done down the road and it didn't work. Well, they might not have drawn enough blood to get a high enough dose of platelets. We know, for instance, for knee arthritis, you need 10 billion platelets or 8 to 10 billion platelets to have an effective dose to make a response. For a shoulder, For a rotator cuff, it might be 5 billion platelets or so. So we know dose matters, and that means the more blood you draw and the better you process it, the better your product is going to be. So we've gotten a lot better since 2008 when I first started doing PRP. We're so much better at knowing what the right dose is, preparing it the right way, et cetera. So we have the bone marrow, which is the cells. The cells do the work. We have the PRP, which is kind of like fertilizer. Now, lasers, I love lasers. People, I don't know if they realize how amazing lasers are, certain types of lasers. So when the sun shines on a plant, the plant grows, and that's called photosynthesis.
Right.
But there are certain wavelengths of light when they shine on an animal or a human, they also stimulate our cells, and that's called photobiomodulation. And a lot of people have pets out there, and a lot of vets will use laser on their pet, and the dog can't lie. They either get better or they don't, right? And same thing with like thoroughbred horses. They get laser therapy is legal. It works, but the horse doesn't lie. So the laser stimulates the mitochondria, which is the little powerhouse of your cell. Everybody knows that from high school biology. And so it makes your cells work better, produce more energy. It decreases swelling and inflammation. It brings in new blood flow. So that brings in, the more blood flow you have, the more oxygen, the more nutrients, the better you heal. And then it also has a direct pain relieving effect. It inhibits the painful nerve fibers that cause pain. So we'll use the bone marrow, the cells, which is kind of like seeds in the garden because I'm a gardener. We use the PRP, Miracle-Gro, and then the laser is kind of like sunlight. And then the other thing we do is we have our V-Motion Fit people. They're like the gardener. They guide and take the person through the program, but also treat the whole body strength-wise. And as a chiropractor, how important biomechanics are, strength. Even people in their 60s, 70s, and 80s respond extremely well to resistance exercises, not necessarily pumping iron, but strength and conditioning exercises. It builds muscle, less likely to fall. And the muscles are the main shock absorber, so it takes the stress off your joints, makes you more confident, and that means also less likely to fall. And also, muscle burns fat or burns energy, and it's better than having fat. So, in that regard, we also have nutrition programs. I'm not going to get into all that, but we have a genetic-based nutrition program. So, how do we know what the best diet is for you? By testing your genetics. A lot of people say, "Oh, I got to eat a lot of protein," but most people find that they actually need to eat more healthy fats. Maybe they still need to eat a little more protein, but the healthy fats are things that are not seed oils. Seed oils are bad for you, cause inflammation, mostly because of how they're processed, not always because they're inherently bad. But we have a registered dietitian who will work with the patient for 3 months or so. We also have another type of a laser that stimulates your fat cells to open the pores and release the fat into your lymphatics, and then you eliminate it naturally. So that's kind of like a jump starter. So I kind of like the analogy that the red light laser is kind of like a weed eater, and it gets rid of all the weeds in the garden, because weeds are like inflammation. They choke out all the plants. Inflammation chokes out all our good cells. And then the nutrition is kind of like topsoil. And then the bone marrow is kind of like the seeds in the garden. The PRP is kind of like the fertilizer. The laser is kind of like the sunlight. And the V-Motion Fit people are kind of like the gardener. So that's how I like to explain it. That's most of what we do. There's other things we do. You mentioned peptides and hormones and things like that. That's a whole nother thing. But in general, if you read the book, that's kind of the whole method there that we use.
Yeah. Is that your Victory Method program?
For the most part, there's the gardener right there. You can see the gardener.
That's very good. So again, make sure to go out and grab it and pick up his book. We'll put a link that's in here with that. So Dr. Marc, I mean, it's, from being a chiro that worked for an orthopedic surgeon, I would love to have a conversation with Dr. Elias as to what you're saying and see what his thoughts are. I don't like, it would be an interesting conversation. Maybe he's doing some of it now. I don't know. He's in downtown Chicago, so I haven't been there for a bit on it. But I would like to ask. I know that you see all different kinds of joints and what you see, but who would be an ideal candidate to come into your practice for the services that you offer?
I mean, honestly, any single person is a good candidate. We treat people from all ages. If you're in pain or you have dysfunction, anybody is a great candidate. But I will say the most common people we currently see are someone who's maybe 65 to 85,
Okay.
a female, a little greater than male. They've worked their whole life beating their body up. They, put their kids through school, and now, they've saved up money for retirement, and they can't enjoy their retirement because their knee or their shoulder or their hip or whatever is bothering them, and they're willing to invest in themselves now. Now, my goal is to end the need for knee replacements by the year 2043. We didn't even really talk about that yet.
Oh.
And that's in the book as well. And $1 from every book goes to the Arthritis Foundation to help raise $1 million, to raise awareness, to help us to start the process of ending the need for knee replacements by 2043. Because remember, I want to prove that chief president wrong. So the point is, actually, what was I lost track of what was the.
No, absolutely.
So the ideal person. So correct. Those people who are 65 to 85, they work their whole life, they beat their body up, they put their money away, they can't enjoy themselves because they have a bad knee or hip or shoulder. Those are the people who are willing to invest in themselves. And they are the ones who are the most common people that we see. I would love to shift it to prevention more. And we talked about this. ACL tears are 50 to 75% of them are preventable with just a simple 6-week preventive exercise program. There are so many rotator cuff throwing, elbow Tommy John injuries. There's a lot of programs that we have that are preventive, but that's a lot harder to get people to do. But eventually, right now I'm treating people who are, they have no choice. They're already past the point where I would like them to be. I would love to prevent people from getting to that point in the first place. And just one, we were talking about this the other day, the bear surgery, the ACL surgery. If people tear their ACL, which is the main stabilizing ligament in the knee, and athletes need it in order to cut and pivot. When you tear that, it's hard to play a sport where you cut or pivot. So the traditional surgery has been to reconstruct it, make a new ligament out of like another tendon of yourself or a donated tendon. And that usually stabilizes the knee, but it doesn't prevent arthritis. People who tear their ACL have a 50% chance of getting arthritis within 4 or 5 years. People who tear their ACL and get a reconstruction, it stabilizes their knee, but it doesn't prevent arthritis. It just pushes it off 12 to 15 years down the road. Okay. So you have about a 50% chance at that point. The bear surgery, bridge enhanced ACL restoration, is where we sew a collagen implant in between the two torn ends of the ACL, and we soak the patient's blood in it, or I'm actually putting, this is off-label, bone marrow cells and PRP. You can do off-label things as long as there's a label, and on-label use, you just have to let the patient know. So it's normally soaked in blood. I talk to the patient, hey, do you want to try putting your stem cells and your PRP in there as well? And knock on wood, we haven't had anybody who's done that on tear their ACL yet. But the point is, when you get that to grow back, the studies have shown in pigs that if they had a group of pigs, they cut their ACL and just let them run wild. They had a group of pigs that they cut their ACL and did a reconstruction, and they had a group of pigs that they cut their ACL and did the bear surgery on. The group that they cut the ACL developed arthritis. The group that they cut the ACL and did a reconstruction, they still developed arthritis. The people they did the pigs, they did the bear on, they never developed arthritis. So we were wondering, does that translate into humans? And that's why I started doing it. I was actually the first one outside of the research studies to do an FDA-approved bear study after the research studies were out. And so it's been, I think, close to 8 years to 10 years since the surgery actually came out in the studies. And what they found is the FDA now is allowing the company that makes the implant to say that it prevents post-traumatic osteoarthritis at 6 years out and going strong. Wow. Compared to an ACL reconstruction. So the point is, we want to prevent injuries in the first place, but if we can't, then we want to do something that lessens or eliminates the arthritis, because once you get the arthritis, that's where you go on to possibly needing a knee replacement. So we can stop the injuries and stop the arthritis before it kind of starts or takes hold. That's how you eliminate knee replacements or joint replacements in the long run.
So Dr. Marc, can you, for that bear method that you're talking about, is that true for both a tear and a complete rupture?
Yeah. So let's call it a sprain, because tear and rupture are kind of generic terms. A sprain can be a grade 1, which is just a very mild stretch. Okay. Grade 2 is like plastically deformed or partially torn. So, and then a grade 3 is completely torn or quote unquote a rupture. So
Okay.
yes, great question. Even a rupture, a full tear, a grade 3, you can sew that implant in between and it will heal. Grade 2 is even better because it's not all the way torn. And grade 1 usually doesn't need surgery. A lot of times we can either just let those heal on their own or inject them with some type of orthobiologic, like PRP or and/or bone marrow cells. But the Bear works very well for grade 3s and grade 2s. Now, it doesn't necessarily speed the rehab up. It still takes 9 to 12 months to get back. It doesn't necessarily prevent tears. Neither does reconstruction. You can still re-tear it. You probably have a 10 to 15% chance of re-tearing it. The younger you are, like people in their teens, 20s, it might be 25% chance, 1 in 4 that you might re-tear it.
Yeah.
But the interesting thing is people who get a reconstruction, they're just as likely to tear their opposite knee as they are to tear the one that they had surgery on. We think that's because they rely on that other knee more, right?
Yeah.
Now, what's interesting is the people who get a Bear, they're much, much less likely to tear their opposite knee.
Interesting.
So that's another advantage of the Bear.
Okay. So do you bring young athletes in from your community, and that's how you kind of do pre-protocols for them of, hey, let's get you in shape for volleyball or basketball?
Absolutely. So we haven't done that as much recently since COVID, but I've been in practice 27 years. So it probably going all the way back to the early 2000s, we ran a program called Sports Metrics, Cincinnati Sports Medicine. Yeah, Sports Metrics. So Dr. Noyes came up with that program, Timothy Hewitt, great PT, and we were trained on that. My whole team was. And so my kids grew up playing sports. I have 3 kids, and 2 of them played in college. Well, all of them played in college. 2 played club and 1 is playing right now in college. And every single one of them went through the program with all their friends. And I will knock on wood, not a single one tore their ACL. Even I can't think of any of those programs where anybody tore their ACL. Now, some of those people were probably lost to follow-up, but for the most part, it's very, very effective in lessening the risk of a non-contact ACL tear. Obviously, if you get hit by somebody, especially in football, or other sports, it's hard to prevent that. But it's much easier to prevent a non-contact injury, which is the most common way someone just plants or they come down from a jump and they tear their ACL. It's because they're landing wrong from the jump. They're landing with their knee too extended. They're landing with their knee out to the side, like knock-kneed. Their hamstrings are weak compared to their quads. There's all kinds of things that we can correct to greatly lessen the risk of tearing the ACL in the first place.
Yeah. With Sports Metrics, it's so interesting. Just the simple step down test and the variation of, like, we did that ourselves. We went and we're trained in it. And when you see a female versus a male step down off of that, and you just see that, curve that goes in,
dynamic valgus. Yeah.
Oh, it's amazing. And when parents go to watch it, they're like, is that normal? And no, it's not. You shouldn't have that. So it's a great tool. There's a bunch of other tools that are out there too, but it's very good. Yeah. Frank Noyes was great to experience that. From a business perspective, what are you doing or what are you looking for to grow your practice in the area?
Well, I think writing the book, I think is a big thing to get the word out, because I thank you for letting me be on the podcast, but I'm on a lot of podcasts and I give a lot of live talks. I give live talks in my office. I give online webinars. I was recently in Dubai before all the shooting. I was lecturing. I'm spreading the word to other doctors, because if we're going to end the need for knee replacement, obviously I can't do it by myself. And even my team is great. We can't just do it by ourselves. So we're educating people all over the world, Nashville, St. Louis, Las Vegas. I'm going to be in Los Angeles coming up. So getting the word out is a big thing, and getting the word out that there is a third option. It's replace, suck it up, or, that's the only 2 options you used to get. But now there's the third option, repair, not replace, using your own body's ability to heal itself.
Yeah.
So getting the word out is probably the number 1 thing that we're doing right now, and that I'm doing, and just getting in front of as many people as I possibly can, and as my team possibly can, because my team also gives a lot of talks, and my PA does, and we got a great team.
Yeah. I'd love for you to share a story about a patient that came in, not this 72-year-old guy here example, but can you share something from a great result in your office?
Yeah, I mean, this story is a great story. It's chapter 1 in the book. So there's this guy named Bill, and his wife is actually our patient. He's not our patient, and her name's Marcia, and she knew us, she liked us, she trusted us, and she was very disturbed that her husband was in a lot of pain. Both his knees were killing him, his right shoulder was killing him, and he didn't trust doctors because he initially was told by his orthopedic surgeon he had a rotator cuff tear in his shoulder, and they did surgery on him, and it turns out there wasn't a rotator cuff tear, and he ended up worse rather than better. And so his wife was like, "God, doc, you gotta see Bill. Everybody tells him he needs a joint replacement. He doesn't want it." So Bill comes in, and he's miserable. And he's like, "I only came here because Marcia dragged me in here. And if you tell me I need surgery, I'm leaving." I was like, "Bill, I don't know if I'm going to tell you what I'm going to tell you, but I do know that my team got all your old records. I looked at everything last night. I know they got all your old history. It's in the chart. I read all that, but I want you to tell me in your own words." Okay. So this is the cycle of insanity. If you got a couple minutes here. So this is Bill and me talking. So he's like, "Oh, it's insane. It's crazy. It's insane." No, just go ahead and tell me. And so we call it the cycle of insanity, not Bill's cycle of insanity, because we've all been through this in some regard, dealing with insurance companies, including myself. So the cycle of insanity. So he's like, "It was insane. I went and saw my doctor, and she's, I said, both my knees and my shoulder are killing me." She's like, "No, I don't have time for you. I got to talk about your blood pressure and your cholesterol and your diabetes. Let's talk about that. But, take some Tylenol, go home. And if you're not better in 2 months, come back and see me." So he's like, "Well, I went and got Tylenol. It doesn't work, doc. And then I went and got some Motrin, and it ripped my stomach up. So I went back and I saw her. It was 2 months later. She said, "Okay, we'll get some x-rays." So I said, "Great. Can we get him here?" And they said, "No, we can't get him here. You have to make an appointment down the road at the imaging center." So I called, I made an appointment. It took 2 weeks to get in, got my x-rays. I asked if I was going to get the results that day. And they said, "No, we can't give you the results. Your doctor has to give you the results." So I went back to see my doctor, and they said, "You don't have an appointment. She'll call you." So I wait 2 weeks. I didn't hear anything. I call the office. They're like, "What are you calling for?" "Well, I want my results." "Well, we can't give you the results. The doctor has to give the results." I'm like, "I know, well, she'll call you." So 3 days later, I get a call, and she's typing on the computer, and she's like, "Oh, your x-rays show arthritis of the knees and of the shoulder. I'm going to probably send you to an orthopedic surgeon because you're probably going to need joint replacements." And he's like, "I don't want to see that quack who operated on my shoulder." So he had to make an appointment to another orthopedic surgeon. He's like, "It took me 6 weeks to get in. I see the orthopedic surgeon. I said the same thing I told you. I'm not doing surgery. If you want me to do it, I'm going to leave the office." And he said, "Well, we can't do surgery." I was like, "What are you talking about?" "Well, you have to go to physical therapy first for 6 weeks, twice a week." And so I called and made an appointment, and I get in there. And the first day I asked the physical therapist, is like, "What's wrong, Bill?" "Well, both my knees and my shoulder are killing me." And they said, "Pick one." And I said, "What do you mean pick one?" "Well, they said, we can only see you for one thing because the insurance only allows us to see you for one thing." And he's like, "But what about my other joints?" "Well, too bad." So I had to pick my right knee, and I had to go back and forth, and Marcia had to take time off from work and drive and co-pays. And after 6 weeks, my right knee was a little better, but my left knee and my shoulder were still killing me. I went and saw my orthopedic surgeon, and I said, "That didn't work. Is there something you can do? I'm a gardener. I want to garden this year." So he gave me a cortisone shot, and I felt great, and I had no pain, and I planted my garden. And 6 weeks later, he gave me another cortisone shot, and I felt great, and I was able to garden for the whole season. And then 6 weeks later, he gave me another cortisone shot, and I was able to harvest my garden. And then Marcia, she's the smart one, and Marcia was like, "I'm the smart one." So did you know that Marcia looked up online that cortisone damages cartilage? And did you know that people who get cortisone are more likely to need a knee replacement than people who don't? And I said, "Bill, I'm very familiar with those studies. That's why we don't use cortisone." He's like, "Exactly." So I went to see my orthopedic surgeon. I said, "No more cortisone." He said, "Well, we can do some gel injections. They make them out of rooster combs. Did you know that, doc?" And I said, "Well, yeah, they're called hyaluronic acid. And you're right. They did originally come from rooster combs, but now they make them in a lab or a factory." And he's like, "Exactly." And I got 5 shots once a week for 5 weeks. And they told me it was going to last for 6 months, and it only lasted 3 months. So I went back and saw the doc, and I said, "Doc, something's wrong. You're missing something. I want an MRI." So he said, "Well, they probably won't, the insurance probably won't approve it. We'll put on for authorization." And after 4 weeks, I got authorization only for the right knee because that's the knee that had therapy. So I got the MRI. I waited 4 weeks again. I didn't hear anything. I call the doctor's office, and some guy answers, and he's like, Dr. Smith said you have meniscus tear, arthritis, bone marrow lesions, and you're going to need a knee replacement.
No.
And I told him, I don't want a knee replacement. And you know what he said to me? He said, you just have to suck it up. And when your pain gets bad enough, come back and see us, and we'll be more than happy to perform the knee replacement. So I took Bill through a full clarity day, because we've already been through that.
Yeah.
We took him from frustration to freedom. He's able to garden. 6 weeks after his program that we talked about there with the bone marrow, the PRP, the laser, the total body fitness, he was feeling 90% better in his knees, 75% better in his shoulder. He's chapter 1 in my book. So I interviewed him 3.5 years out from his program. He's still gardening. He's still 90% and 75%. And he has like the worst arthritis you could see in his shoulder. He has bone on bone in his right knee. And then he's 4 years out now, just recently got his book, and he's still maintaining. So I think that story is a great story of the cycle of insanity, what most people go through. They don't realize there's another option. And we were able to take him through. And I told him all about Dr. Hernigou's study and all that stuff. Mm-hmm. And he took the leap of faith, and he trusted us. And we were all in to getting him better, and he's still doing well.
Yeah. What overall, Dr. Marc, what was the time frame kind of from when was it 6 months? It was over a year or 6 months.
So the program that he went through took about 12 weeks, the maximum part of it. Okay. So usually most of that takes about 12 weeks, and then we'll still see people. We'll call it, we basically give them a membership for a year. So the first 3 months is, the first 3 days after your procedure, let's say if you need a procedure, you're pretty sore, but it's nowhere near as bad as a surgery. I had it done on my elbow. And then the first 2 weeks are the most limited. After 6 weeks, most people are about 50 to 90% better. And then by 12 weeks, you've reached your maximum rate of improvement. That doesn't mean you still can't improve, but you're back basically doing the things you want to do. Even some people get back much sooner than that. But then we still follow people once a month until that final year follow-up. We'll get an x-ray. Sometimes we'll do an MRI. Some people still sign on to do more, of the programs that we have. But most people, after that 3 months, they're pretty much on their own, or after that year. And Bill's on his own. There's another woman named Diane. She comes in once a year. She's 5 years out now. And she just does all the exercises and everything on her own. Because that's the most important thing. We want to get you better, but then we want to teach you how to eat, what the right foods are based on your genetics, what the right exercises are based on your genetics, by the way, too, and what you had done and what's wrong with you, and then allow you to stay better by taking care of yourself, equip you with what you need to be able to do. We don't want to see you every, 6 weeks for a cortisone injection.
Yeah. Yeah. I love the functional medicine approach from true functional biomechanics. And then, as you're saying, genetics, you're taking the functional medicine approach from, gut biome and from, DNA sequencing. So, absolutely. I mean, it's an amazing opportunity that people have to come and see you in your clinic and what you do. So you've been a great guest. I appreciate it. I think we're going to have another one at some point in time, because there's probably a lot more that we can discuss with that. But I will make sure to share the links about your book where people can get that. But if they want to learn more about how they can do telemedicine with you, or how they can come in as a patient, where would you like to send them to?
Yeah, so victoryinmotion.com. Victoryinmotion.com is our website. I'm also Dr. Marc Pietropaoli is on Instagram, TikTok, Victory in Motion 1 for YouTube. And we also, let's see, what else? Phone number, 315-685-7544, 315-685-7544. But I think we also have 315-993-KNEE. That might be easier. Oh, okay. 315-993-KNEE. But if you just go to our website, victoryinmotion.com, that's the key. And if you want the book, Amazon, and just type in repair, not replace. Easy enough. And all the contact information, everything's in the book. So I think getting the book, reading the book is probably the best way to familiarize yourself with what we do. And then maybe you can find a doctor who does that, or get in touch with us and we can help you out.
Yeah. As I said, I have the book. I appreciate you sending me, a read on it, and I'm partially the way through it. Just got it last week. It's very, very interesting. And very user-friendly to read. And the images that are in there, not that I like coloring books. It's not a coloring book by any stretch of the imagination. It's very informative, but it takes me through the paths that you say. And it gives me an idea of how instead of just reading, it allows me to kind of see a vision of what I go through there. So thank you for that. And I'm sure the people that do read it are very much appreciative of that. So last question I'd like to ask of you, Dr. Marc. You're a great guest here on the Prime Health Podcast. What would your definition of prime health be?
I think my definition of prime health would be taking care of the entire body and not just focusing on one part, because as an orthopedic surgeon, we are taught to just take care of one part. And a lot of medicine nowadays is so specialized and subspecialized that we forget that there's a whole person there.
Yeah.
And you're going to always get better results with a whole person. Also drink more water, half an ounce to an ounce per pound of body weight per day. I'll talk to your doctor first about that, but I think people don't drink as much water as they need to drink either.
A culprit of that myself, unfortunately.
I saw you drinking some.
I had it there, yeah. So I'm working on it. It can teach just old dogs and new tricks.
Glass right here, pure water.
Yeah. So Dr. Pietropaoli, I really appreciate you being a guest. We've had some personal conversations about dealing with, my son who's got an ACL. So I really appreciate the share. The people that are in your area or that are watching this, I always ask if there's one thing he said, and he didn't just say one thing, there's multiple points that he brought up that can help you in your health or somebody you know. Now, whether you're close to him in the Syracuse area or around, if he does, telemedicine, reach out to him, share it to somebody that you played pickleball with or something where you can ask some questions. And again, whether they find a provider where they live locally here, if it was in Idaho or if it's in, Pennsylvania or anywhere around, please make sure to reach out to them. And I can so much appreciate what I'm going through now with my son and his knee, which you have the ability to offer people in your community. And again, it's not just knees, you're doing all, full body, and what your entire team does at Victory in Motion is unheard of really in the industry. To go from an orthopedic surgeon, the story that you told me, how it first started, to what you're doing now of proving that surgeon wrong. I love to hear that. So I would love more people to share this out there. And I always ask people if they would subscribe to the podcast. It helps us a lot more. We'd love for you to share with people. Yeah, as well. So until next time, remember, we're all on this journey together towards true wellness. Now, whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So please do stay committed to your Prime Health journey. Again, Dr. Pietropaoli, thank you so much for being a great guest on the Prime Health Podcast.
Thank you, Dr. Barron, and thank you all of you who listened and watched. Thank you.